Dr. John Oldhan is a practicing GP and the National Clinical Lead for Quality and Productivity at the Department of Health in England. Sir John was instrumental in bringing the collaborative improvement method to the UK. The Primary Care Collaborative, which he founded and led, remains the world's largest improvement program, covering 32 million patients. In 40 months, it delivered a 72% improvement in access to GPs and substantial reductions in mortality to patients with heart disease. Dr. Oldham also founded the award-winning Healthy Communities Collaborative that trains and involves residents of deprived areas as members of improvement teams. He's written several books and numerous articles on quality improvement and large system change, and is currently a member of the National Quality Board in England, setting the strategic direction for quality and safety in the NHS. In 2003, he was awarded a knighthood for services to the NHS.
I'm a primary care clinician, and I built up and led my primary care practice for quite a while. But I also did work on quality improvement, transitioning between industry into healthcare back in the 90s. And that led to me leading a huge collaborative in the UK called the Primary Care Collaborative, which I then, because of its success, did in Scotland and Australia and other places. And that really has hallmarked my career, really, which is trying to get others to improve the quality of the care they give their patients. It wasn't so much that it was a planned route. It was that it happened because did things, it built from the relationship with patients upwards. That we did things in our practice which gained national awards, and because of the national awards I was asked to take on some national work. So I was sucked into leadership rather than that I had a planned route into it at that time. But the same thing that drove me to become a clinician in the first place is the same thing which drives me in doing what I do in a leadership position. I still see patients, and for me, it's the core of what I do. It's where the big picture and the blue sky thinking and the strategic thinking is rooted in the reality of people's everyday lives, both the providers of care and our patients and the environment they have to live within and work within. I think the surprises were that I didn't know how to do it, that nobody had trained me of the issues relating to managing people or how you formal leadership training. So effectively, like many of my generation, we just winged it. I learnt when I did my MBA about leadership skills and about some of the things which consolidated some of my intuitive things. But at the time, when we first started it, you just learnt and made mistakes as you went along. Challenges are overcoming the shibboleth of clinical autonomy, that everybody believes they're doing a great job until you compare them to others. And improvement and leadership for improvement is, of course, trying to get people to act collectively when they believe that they can act as a sole clinician. And overcoming that mindset, I think, is the biggest challenge. Alongside that, you are challenging in what you do huge vested interests that exist within medicine in our country, in Royal Colleges, in the British Medical Association, and much of what you do challenges that. So there's a huge political element to what you do. What's rewarding, I think, is seeing the results of getting people to act collectively and seeing the results for patients and what it has meant to individual communities, and seeing people who you've come across on the journey and tried to nurture and move, now themselves taking leadership positions. That I get a great deal of satisfaction from. This whole thing is about creating networks and coalitions of influence, particularly in the sphere where you are trying to encourage and get people to change over whom you will have no direct managerial control, and finding what it is that will make them tick, that will touch their souls and make them want to move, and in doing so, understanding right from the outset that you cannot do this alone, that you need a network of people to help you achieve, so that that leadership is diffuse. Do you know, I've never been lonely in my leadership positions, and I think some of it is because of that network we've just been talking about, and it really is not something that's resonated with me. I think the thing that you learn from failure, now all of us fail at some point or another, and no leader I know has never had stumbles along the way, is actually to try and detach yourself from the emotion of it and understand what it was within what happened that you can make sure you mitigate against next time round. Because whenever you are pushing the boundaries, whenever you are actually seeking to make major change, there are things that will happen in the environment, particularly when you're doing what I've done, large-scale change. There's stuff that will happen that you can't necessarily see coming. But I think the most important thing is twofold. One is to learn from it, and the second is that expect it. I think resilience is a crucial characteristic of any leadership position. And what I do is work with people I know and trust, close to me. But I have to be honest, the greatest source of my resilience is in fact my family, my wife, and our devotion. That gives me greater resilience than anything in my professional sphere. It is the opportunity to shape and change the care for millions of people. That in doing so, working with a whole host of wonderful clinicians and managers throughout the country to achieve that bigger change. It is in fact the same driver that took me to being a clinician and a doctor in the first place, just on a bigger scale. And knowing that there are things that you have started which, in the words of one school child who wrote to me, this has changed my life. And that is what excites me. The first thing to do is to recognize that when you want to do a large-scale change, you plan initially for that large-scale change. Pilot and spread won't do. Actually, you've got to think through, how am I going to do this large-scale change? What's the infrastructure I'm going to create to do it? How am I going to identify the people who will take this with me? Not informal positions that you employ, but actually a coalition of the willing, but embrace the coalition of the willing and their energy and their positivity to get you to where you want to go. The second most crucial thing is that this isn't just a soft option. Improvement isn't a soft option. That if we are going to do something, then we have to have the discipline and the rigor to implement that in a way that means we know we're going to get it implemented. that just having a myriad of small projects isn't going to take you through that glass ceiling. So whilst you have to energize people, and 80% of it is hearts and minds, with that energy has to go a belief and an understanding and a mechanism that means that the implementation has some discipline, not least about measuring how far your progress is. I don't think the two are mutually exclusive. It's a both and, both competition and collaboration. Many times in non-health spheres, you see people who in other ways would be competing, actually collaborating to take things further forward. Within healthcare, when we're looking at making improvements and taking innovations and getting them places, there is nothing better than being transparent to everybody about where everybody is in that journey of improvement by their data being tangible and explicit and open to everybody. That ginger of people knowing where they are, not least in my view, and I'm a strong advocate that patients should know the performance of their healthcare organization so they can make the comparison and have a pull effect on quality. So there's a competition in that nature that people understand where they are. The collaboration bit comes in this way, that if we share together, if we learn together, and if we implement together, we do it faster. And that is what some of the techniques that I've used in large-scale change have helped achieve. So a ginger that there is competition because everybody wants to be good, and a collaboration in how we actually get to the point we want to get to.